For the first time in more than 30 years, the U.S. has surpassed more than 2,000 measles cases. That's according to new data from the CDC. The last time this happened was in 1992. Measles has been considered eliminated in the U.S. since 2000. However, the U.S. is at risk of losing that elimination status if cases continue to grow through late January.
All right, y'all. Just when we thought we had enough to worry about with the super flu, yes, I'm still calling it that, guess what's trying to make a comeback? Measles. Yeah, that old school disease your grandma told you about. Apparently, it's not just a thing of the past, because right now, health officials are sounding the alarm after confirmed cases popped up in major U.S. airports in Boston and New Jersey, and also in Spartanburg, South Carolina and surrounding areas. We're talking about a disease that was practically wiped out in 2000 in the U.S. So what happened? Why is it back? And do we all need to start bubble wrapping ourselves again? Let's break it down. First, a quick refresher for those who weren't around for the OG measles epidemic. Measles isn't like the flu or a cold. It's way more contagious. We're talking walk into a room where someone with measles was 2 hours ago, and you might catch it. Contagious. It hangs in the air like bad gossip. If one person has the measles, they can infect up to 90% of the unvaccinated people around them. 90%. That's almost everybody at your family reunion. The symptoms start with a high fever, cough, runny nose, red eyes, and then a few days later that classic rash pops up, usually starting on your face and then spreading down your body. It can be serious too. We're not just talking about spots. Measles can lead to pneumonia, brain swelling, and in rare cases, even death. Before the vaccine, measles killed millions worldwide every year. It's not a joke, honey. So, what's the tea on these new cases? We've got alerts for Boston, Logan Airport, and Newark Liberty International Airport in New Jersey. That means if you are in certain terminals or areas during specific times, you might have been exposed. Health officials are telling folks to check their vaccination status and watch for symptoms. But why is this happening now? After we thought we'd kick measles to the curb? Well, it boils down to two main things. First, international travel. Measles is still common in other parts of the world, so travelers can bring it in. And this is the big one, the decline in vaccination rates. The MMR vaccine, measles, mumps, and rubella, is incredibly effective, like 97% effective with 2 doses. But because of misinformation and vaccine hesitancy, some communities have lower vaccination rates. You lose what we call herd immunity. It's like everyone decided to stop locking their doors, and now the neighborhood watch is useless. Now, back to staying safe. So, what's your game plan? The absolute best thing you can do is make sure you and your family are up to date on your MMR vaccine. If you're not sure, call your doctor. Seriously, just call them. It's a 2-dose vaccine, and if you've had both, you are practically bulletproof against measles. If you were born between 1957, you probably had measles as a kid and are considered immune. Now, if you were at one of those airports during the exposure times and aren't vaccinated, contact your doctor immediately. They can advise you on what steps to take. This isn't just about protecting yourself. It's about protecting babies too young to be vaccinated and people with weakened immune systems who can't get the vaccine. We live in a community, and community protection means we all do our part. Measles coming back is a wake-up call. It shows how fragile our public health can be when we let our guard down, even against diseases we thought were long gone. It also highlights the global interconnectedness of health. A case halfway across the world can quickly land on our doorstep. So I want to hear from you. Have you
We know MAGA doesn't believe in science, especially vaccinations, and it shows. An outbreak of measles has taken place at a Noah's Ark attraction in the state of Kentucky. Health officials are warning the public that on December 29th, a child contracted measles after visiting this Noah's Ark attraction, and over 775 people could be at risk. Health officials are warning those who visited to monitor your children and yourself between now and January 15th, as measles is highly contagious. They ended the bulletin by saying getting vaccinations are the best way to prevent measles. Last year, there was a large outbreak in a county in Texas where only 1 in 4 people were vaccinated. 2 children lost their lives, and RFK said that herd immunity was the best way to protect against measles. Going back to Noah's Ark, I wonder if this attraction had the 2 gay lions. In case you missed it, in the 90s, a lot of people pointed out that the 2x2 animals going into the Ark included 2 lions with manes.